Let's begin with patient interaction. In a short case, your first opportunity to shine is during patient interaction. As you enter the room, establish rapport with a warm greeting and steady eye contact to build trust. Before you proceed, remember to perform proper hand hygiene using the alcohol hand rub provided in the room. Clearly explain what you're about to do by outlining the physical exam process and obtaining the patient's consent. Use simple language to describe each step so that the patient feels respected and comfortable. Keep in mind that examiners are not only evaluating your technical skills, but also observing how empathetically and clearly you communicate with the patient. Once you have set a positive tone, move into the physical exam with precision. Use the standard techniques as taught in your local training, college resources, and the standard textbook. Your approach should be both smooth and efficient. You need to complete the exam quickly without sacrificing accuracy. It's essential to be mindful of the patient's comfort at all times. Avoid any maneuvers that might cause pain. Your examination should clearly reflect both your competence and your genuine consideration for the patient's well-being. Thoroughness is another critical aspect. For example, if the case instructs you to examine the gastrointestinal system, you are expected to follow every step in the standard sequence as outlined in your textbook. This means performing each component of the exam meticulously and ensuring that no part is missed. While you don't need to provide an exhaustive commentary on every detail during your exam, it's crucial to offer clear and concise instructions to the patient at every phase. Your narration should succinctly explain what you want the patient to do to facilitate the exam. At times, examiners might request that you omit certain steps that may not be essential, so be prepared for that flexibility. Accurate documentation of your findings is paramount. You must correctly identify and interpret abnormal findings without erroneously reporting signs that are not present. For instance, if you are assessing hepatomegaly, you should clearly describe the liver edge, its size, consistency, and tenderness, and quantify the extent of enlargement using established techniques. Additionally, mention any associated findings that either support or challenge your assessment. This precision demonstrates your attention to detail and your ability to use standard grading systems effectively. Finally, based on your examination, you are expected to offer a coherent differential diagnosis. Integrate your physical findings into a logical narrative that explains the most likely etiologies. For instance, when evaluating hepatomegaly, consider differential diagnoses such as congestive hepatopathy, chronic liver disease like cirrhosis, or infiltrative conditions, and be prepared to discuss why one diagnosis is more likely than the others based on your physical findings and the clinical context. Beyond the diagnosis, you should be prepared to discuss potential investigations and management strategies. Explain which tests you would order to confirm your suspicions and outline a brief management plan that addresses the patient's current needs. This discussion should be evidence-based and tailored to the specifics of the case, reflecting your strong clinical reasoning skills. In summary, short case assessment domains encompass patient interaction, examination technique, thoroughness, accuracy of findings, and the ability to generate a differential diagnosis and management plan. By ensuring clear communication, executing a smooth and efficient exam, recording meticulous and accurate findings, and engaging in logical, evidence-based discussion, you demonstrate both your clinical competence and your commitment to patient-centered care. This comprehensive approach is crucial for success in your short case examination and will serve you well throughout your clinical practice.